Reports from inside the Ionia County Jail indicate that a group of inmates suffering from what ended up being carbon monoxide poisoning were forced to wait days before their appeals for medical attention were recognized. News 8's Duncan McLean spoke with a partner of one of those inmates about that ordeal, who told him it isn't over yet.
A number of inmates communicating with News 8 via loved ones today, saying that they're still feeling the health effects after a carbon monoxide leak hospitalized a number of inmates here over the weekend, adding that it took days after their initial complaints for their health care needs to be addressed. Inmates first campaigned for medical attention on Wednesday last week.
He said that he was puking up black, his lips were turning blue, that sort of stuff.
One laid out the timeline of their first appeals and eventual transfer to hospitals, saying they begged for ambulances, and it took the entire group of them throwing up in the middle of the night to finally break through.
He said that he covered his face with his blanket to kind of like filter out the air, and when he was laying down, he thought that he was going to die. He said that he was angry. He just didn't want anybody to talk to him, and that in the morning when they woke up, the third day, the firefighters were there, and they confirmed that there was something wrong. From there, the affected inmates were treated at area hospitals, some as far as Grand Rapids. Telling their family, medical professionals said their symptoms were consistent with severe carbon monoxide poisoning. The county issued a statement confirming a carbon monoxide leak was caused by a malfunctioning boiler, leading to the hospitalization of 9 individuals, and claiming that they took swift action to remove those inmates from affected units into fresh air. When those inmates returned to jail, though, so did their symptoms. One man moved into a holding cell for observation after he said he was still ill. Told him he was having a medical emergency, took the papers to him, and then he sent me the message that he still wasn't getting help. I haven't been able to contact him because he's been in the holding cell for observation. When I called yesterday, they said his levels were at like a 4. And when I looked that up, it says that it requires immediate medical attention.
Carbon monoxide detectors are required by state law in all private residential situations, even including transient housing like hotels, motels, and boarding houses. But there's no specific requirement for jails. Additionally, the Michigan Department of Corrections has explicit rules for when an inmate requests medical attention and for ventilation requirements in facilities that could be subject to carbon monoxide buildup. News 8 was told by the Michigan Corrections Organization that county facilities are not subject to those rules. Requests for the specific medical guidelines to the Ionia County Sheriff's Department went unanswered today. News 8 spoke to 2 additional people off camera who spent time in that facility since 2020. Both reported that they witnessed others being denied health care or had a hard time getting necessary medication themselves. In Ionia, Duncan McLean, News 8.